Welcome everybody to season 3 of Pro to Pro. I want to thank all our followers and all our supporters. We wouldn't be here if it wasn't for you. We took season 3 to the road. We're actually at our podcast guest home right now in Atlanta, Georgia, and we're super excited to bring to you his episode and all the upcoming episodes for Pro to Pro. Thanks again for your support, and remember, keep it Pro to Pro.
Pro to Pro, let's get it, let's grow. Game time talk for the ones who know. From hustle to vision, we breaking it down. Still for the top, then remember the name. Pro to Pro.
Welcome everybody to another edition of Pro to Pro. I'm here with my friend, Dr. Ed Farrior. Ed, welcome to the program.
Thank you, Keith. Good to be here.
I'm really excited to talk about a lot of the things that you bring to the table here. You're a facial plastic surgeon you've been in the Tampa area all your life, which is really interesting. Yeah. And we talked off camera about the fact that you are a 6th generation doctor.
Correct.
So talk about pressure. That in and of itself, when I think about that, I'm saying to myself, okay, did you have a choice in entering the medical field to begin with? On the program, we tend to go over a couple things. We talk about relationships, we talk about exercise and health and fitness, and obviously we talk about a career, the evolution of the career. You clearly started in a business that in today's time is unbelievably, let's just say, demonstratively huge with the advent of not only social media, but medicine in general, and the vanity and aging issues associated with people. But you made a decision early on to enter that field when it really wasn't a field, let's just say, that was in vogue, so to speak. Yeah. So talk a little bit about how you evolved, like your formative years growing up, and how you ended up making a decision to become a facial plastic surgeon.
Sure enough. Well, formative years, you always think kind of junior high school. At that point in time, I was probably a great deal of trouble.
Really?
For my parents. Well, I grew up in Tampa, lived on the water, out in the boat, drinking beer, maybe a little bit on the young age, only because I looked old at the time and I could walk into a 7-Eleven and buy beer, which was kind of unusual for a 16-year-old. But anyway.
Yeah.
And so a lot of fun, a lot of really close friends, not necessarily strict. In other words, my parents gave us a lot of latitude as long as we had some guardrails on it. And, I can remember as a kid, 12, 13 years old, my brother and I would get in a little John boat and go chugging out into Tampa Bay with a 9.5 power engine and spend the night on the Spoil Islands out in the middle of Tampa Bay by ourselves, set up a tent, cook some dinner, hang out, swim, goof off. Yeah. So it was great. You can't beat growing up on the water, quite frankly. And I count that blessing every day. But then in the first year of college, a little bit of the same, enjoying the freedom, the autonomy, the independence. And, back then the drinking age was 18.
Yeah.
And so you could go out and do stuff and have a beer and do things and realize if I really wanted to get into medicine, I could not keep going that route.
Was there pressure on you to go into medicine? Your what type of doctor was your father?
He was the same thing, otolaryngologist, head neck surgeon, facial plastic surgeons. He was actually one of the founders of the Society for Head and Neck Surgery, which is cancer surgery above the clavicles is the easiest way to describe it.
Which is right here?
Yeah.
Okay.
Your collarbones.
Collarbones, okay.
Yeah. And was also the 4th president, but one of the driving forces behind establishing the American Academy of Facial Plastic and Reconstructive Surgery. So, and this was back in 1964 when that started.
And was he a Tampa bred?
Yeah, he was born on South Newport, 806 South Newport in Hyde Park.
Oh, wow.
In the house, in the front bedroom. So whoever's living in that house now, that's where my dad was born. went to Gorey, Wilson, Plant, started at the University of Florida, but that was at the beginning of World War II. And so was too young. He started in college at 17, was too young to outright enlist. So he entered a officers training program, and in the training program got transferred to the University of Miami. And as soon as he graduated from Miami, he was sent to Key West to be in the naval station at Key West, and that was about the time the war ended.
Mm-hmm.
And then went and did his residency, did a fellowship in Detroit, Michigan in plastic surgery. So he was qualified to be both an otolaryngologist, head and neck surgeon, and a plastic surgeon.
Where was your grandfather?
My grandfather was a surgeon here in Tampa. He passed away when my dad was 7 years old.
Oh,
so he
okay.
passed away at age 50, and my dad was raised, he was the sixth of six children. So he was really raised kind of by his closest sibling was 4 years older than him. So he was kind of raised by her and his mother. But, you know, he used to go Spanish Crown Creek, which was in Hyde Park. It's now closed over culvert. You can't even see it. It kind of runs by right at Azeel and Platte is about where it starts. There's a nursing home there called Allegra that is where the creek used to start, and it ran out into Tampa Bay. And they used to play in that creek and go out and sail on Tampa Bay as kids and do everything. So he's seen all the changes. You know,
So
he knew the
population-
streetcar on Tampa Bay.
Yeah, population back then in comparison to now, what was it estimate-wise?
Oh, goodness. Probably 35, 40,000 people.
Oh, my gosh.
And the biggest industry then was shipping. My dad, he was a character, and I got to talk about him a lot because, of course, he had a huge influence. I think he was a true genius, and he had a hard time holding back because he was so much smarter than most people that were in the room with him that he demonstrated a great deal of self-control as far as that goes, especially raising us.
How many kids in your family?
4.
Okay.
I've got an older sister, an older brother, and a younger sister.
Okay.
But he was a unique guy. And like I said, started a bunch of societies to organize the educational aspect. And that's what most of the societies are. The Society for Plastic Surgery, the general surgeons, the otolaryngologists, the facial plastic surgeons. The associations are the educational side. And then there's the certification side, which is the board certifying bodies. The American Board of Medical Specialties, and all the boards are subject to their governance.
So it's interesting that you bring up the society aspect of things among peers, because we talk a lot about this. You know, I do mentorship. We talk about, you know, the platform itself is designed to help people in growing in their particular area. So individuals who are already at a peer professional level, it's a peer-to-peer society in which you're all learning more from each other and you're all embracing additional information and education. Is that part of the process as a society?
Certainly is, on a constant basis, and feel strongly about needing to stay engaged with all that because it keeps your practice younger, because you're learning, you're always going. And when you give a presentation, someone, well, you know, why didn't you do it this way, which is the way, you know, I heard another physician describe it or something like that. And you have to think, okay, is there merit to doing it differently? Or is, you know, there's some anatomic reason or physiologic reason I'm doing it the way I'm doing it? So it either opens your mind to other things or affirms the decisions you're already making.
Do you find that there's humility within? And what I mean about that, the group itself, you're all learned individuals. Your dad had, you know, you suggested he was extremely bright, possibly the brightest guy in the room at the time, but he recognized the importance of the societies and of the education aspect of that. I find at times, and people who may be watching or listening to us, a doctor in general could have a tendency to not want to evolve anymore or feel like they know it all. Whereas you're talking about instances in which there's education among peers to a point where maybe I'm not doing it right, or maybe this way could be a better result and things like that. How is that reconciled in your industry?
Some people embrace it and are a little more introspective about things, and other people's, dig their heels in and won't change regardless. I would say, my dad was always a listener. He was one of the people, even in his senior years, up into his 70s, if he went to a meeting, he was sitting in the front row. He wasn't in the back row, distracted. And of course, he didn't have social media. He didn't have a cell phone to get distracted by.
Yeah.
But he was always sitting in the front row, listening to younger people talk and express new ideas and supporting them and encouraging them in their work and their research and stuff. So he was always out there, and he always kind of described, what he was doing as, as a matter of fact, he just passed away in October.
Oh,
and
sorry.
Have been working on a obituary for a medical publication. And one of his original fellows, who was a helicopter pilot in the Vietnam War and then came back and went to med school and then went on to train with him and has been in Portland, Oregon ever since, a gentleman by the name of Ted Cook, fabulous guy. But he was telling me, your dad always told me, love your patients and respect the tissue. And that's, excuse me.
No, that's beautiful.
Yeah.
It's beautiful, Ed.
And so that's the perspective that I come at this whole thing from. It really is about loving the people you're trying to help.
Yeah.
You don't have to be in love with them, but you need to love them as individuals and try to get them to appreciate what you're doing for them, but to also get involved in the decision making. I try to educate patients, tell them, these are your options. These are the advantages to this option. This is the advantage to the other option. And, you choose. You tell me what you think fits your lifestyle, your economy, your personal goals best, and I'll try to customize a treatment for you and go from there. But, it's, you think about all these things and you go back, and especially as you get more mature in your practice, and, I guess the biggest thing with losing both my parents, you go, oh, wait a minute. I'm in the
mortality.
I'm on the front row now.
Yeah, that mortality kicks in for all of us. And one of the reasons why I do this podcast and I'm so fervent about health and fitness is, I got a lot more years that I want to live and enjoy. And as we get older, we think about that all the time. It's clear that your dad imparted an incredible influence on you. And I know firsthand and through your reputation that you impart that same to your patients, and you treat your patients so well. And it's known in the community how you are and how you present. How has it been the evolution of plastic surgery in general in today's time in regard to when you started? Because we're in an instant gratification world. And back in the day, when I think back, even growing up in the 60s and 70s, plastic surgery was like only for the celebrities or would be only for the very wealthy and the vanity associated with it. Today, it's in everybody. Even to the point where I see things that we can talk about in regard to younger people probably doing it when they shouldn't do it for whatever reason, because it's available. Yeah. So how has it evolved? What have you seen over your career?
I would have to say the biggest evolution, which I'm not too enamored with, is what's happened in the last 7 to 10 years with social media, both consumers kind of misrepresenting themselves a little bit as far as their outcomes, and physicians misrepresenting themselves. And so I'm old school. You know, when I finished my training, you didn't even put an ad in the Yellow Pages. It was unethical. You didn't do any self-promotion whatsoever. You went to the emergency room, you covered call, and you were available when somebody had an emergency, and that's how you built your practice. And so the social media has made it change, and kind of, not to kind of bring my dad into too much of it, but it was interesting that if he had patients that told him, well, they saw this on social media and they wanted him to do their surgery this way, he'd have thrown them out on their rear ends.
Yeah.
He would not have had the patience to tell them, he was educated. He knew what was the right way to manage their problem, not somebody that they listened to on television or something. So,
well, the other thing we see with social media is misplaced concepts, right? They are delusional with regard to the expectations of the result, right? And that is painted by, let's just say it. It could be providers who are their integrity is questionable. Photoshop. It could be part of it as well. So, I mean, this goes on industry-wide.
Yeah, no question. The filters have kind of created a nightmare because influencers, whether they're talking about surgery or, where you go eat dinner, most of them have applied a filter to their face, to their presentation as they're on social media. And so people will come in and say, look at this. And I'm going, okay, eyes can't be that big. Noses don't grow that way. It's not the way this person looks. They've applied filters to it. They don't look like that. And so you need to keep it all in perspective. And most people do, but it's interesting. I've got a 2.5-year-old granddaughter now that's here in Tampa. I have a couple grandkids in Dallas too. And I was watching Frozen with her. And I was looking, I'm going, well, no wonder. Anna, and I can't remember the other one's name in Frozen, but anyway, they both have these stylized, turned up, over-projected, what I would call over-rotated noses. And I'm watching this, I'm going, wait a minute, that's the way half of the people on social media now are representing their nose. A lot of patients come in, and when they describe a nose, they're describing this cartoon animation nose from Disney. And it's the generation, because that's, that movie came out, and now the people that were watching it a bunch when they were kids are 18 to 20 years old, and they're wanting to look that way. And I'm going, this is not reality. That's,
So it's like a cultural evolution of they've been swayed into an expectation that's not realistic.
Yeah.
So how do you manage that as a provider?
Very carefully, because you have to listen. And what will happen is, if you don't listen to them, they'll just go somebody that will, and will say, yeah, I can do that. And then they can't do it. And then they come back 3 years later and their nose is messed up, and you got to try and fix it, which is really difficult.
Yeah.
So you have to listen. And then we have, digital imaging, where we take a program and show them what is realistic and what can be done with their nose, not trying to sell them a rhinoplasty, but to show them what is realistic for their face, what fits their face, what's worked good for them. And again, it's educating them and helping them make a decision and get off that, swooped out, turned up nose that is not natural. And you'll see a lot of people, and this is my side of, meaning professionals, that it, again, kind of makes me a little bit insane, because a lot of people in my business will feel they need to put things on social media all the time. So they will show you a preoperative and a on the operating room table picture of the patient and represent it as a result. And a rhinoplasty on the table looks nothing like it looks a year later. But that's how they're representing things.
A lot of people wouldn't even know that.
Ed, they don't. Most people don't know it.
Yeah, they don't know that.
Yeah.
You just shared a tidbit that I didn't know.
Yeah. And if I see one of my ex-fellows, because I've got 40 of them.
What's an ex-fellow for the people who are listening, watching?
Fellows are people that do an extra year of specialty training, typically in a subspecialty. Like a surgeon will go to a fellowship in cardiovascular surgery. An orthopedist will go to a fellowship in hand surgery.
That's important because you do that and you've been doing it for years. So you're essentially mentoring these folks, these young people.
Yeah. And if when they're training with me, I tell them, don't ever do that, because if I see you doing it, I'm going to call you out. And then the ones that occasionally do it, I call them out about it. So you're misrepresenting stuff. You're giving patients false expectations by showing them these photographs on the table and saying that's what the nose is going to look like a year from now. It doesn't. Scar tissue matures, it changes, sometimes for better, sometimes for worse.
Yeah, yeah. What percentage of your practice do you think is rhinoplasty nose jobs?
Probably 50%.
Okay. Has it changed over the years?
It's always been the biggest portion of the practice. The other 50% is made up of, eyelid surgery, facelifts, and the more kind of anti-aging rejuvenation surgery versus rhinoplasty. And rhinoplasty is both cosmetic and functional, because most of the people that need to have their nose done always have, they usually have breathing difficulties, because most people have some deviation in their septum, some worse than others. And so if you say straighten a nose or take a hump off a nose and don't straighten a septum, you're going to make somebody congested that isn't.
And so you actually make it worse.
Yeah.
I remember growing up, there was a stigma with plastic surgery. That person must have had plastic surgery. Clearly, in today's day and age, a lot of people wear it as a badge of courage that they even went through it, and other people are, who cares? And I think more along the lines of, who cares? You had surgery, whatever. You could take care of yourself. Has that also changed over the years? Have you seen? It's
all changed, and I'll come back and integrate a little story about some of the bad changes, but it definitely became more acceptable. Part of that was because a lot of the ancillary things became safer. When I was entering the field, typically cosmetic surgery, say rhinoplasty, was usually done with local anesthesia because the general anesthetic was dangerous. Usually people would almost always be nauseated after the surgery. You're worried about putting anybody to sleep. Nowadays, with the improvement in some of the medications, both the narcotics and the analgesics, and the amnestics, things that make you lose your memory, have improved so much, and they're so short acting that when you turn the medicine off, the patient wakes up. And so the anesthesia is safer. So there's more surgery done with either heavy sedation or a general anesthetic, which makes it much more acceptable to people that aren't afraid of it.
Yeah.
That it used to be, we'd break somebody's nose with them awake.
Oh, wow. Okay.
And so, and that was, regardless of how numb their nose was, there was an experience to it that wasn't necessarily pleasant. There's a sound.
Yeah, I could just imagine. Yeah.
So that's changed. I think the biggest thing that really pushed the acceptance of cosmetic interventions forward were all the non-invasive things, the injectable fillers, the Botox, because they helped people enter the market at a lower price point. And someone who could not afford, say, a rhinoplasty or a facelift could get some Botox to help with the wrinkles, or a little filler in their nose to make it look like the bump went away.
Not as invasive.
Not as invasive, and nowhere near as expensive.
Sure.
And so people started doing that, and then it got them in the mindset that you can do these things, you can look better, and there's nothing the matter with looking better. And then the other thing is the fitness thing in the last 10 to 15 years. Unfortunately, there's a huge dichotomy in our society, in that there's a whole population that's gotten less fit. And I think the bulk of us have gotten more fit. And so people feel great and they want to look great. So they go, they'll do these things because, they'll look in the mirror and say, I feel like I did when I was 30, but I look like I'm 60 now. I need to get a facelift or something like that. So the less invasive things, and anybody that does fillers, including your lovely wife, would tell you, fillers aren't necessarily non-invasive. There are risks associated with it that you got to inform people about. But relative to surgery, the risks are minimal.
Well, it's interesting with regard to fillers, and obviously with my wife, I get information anecdotally here and there, and we talk about it. Seems to be even evolving now, where fillers were heavy. People were like, they all want filler. Their faces, people's faces it got to a point where it was distorted. They looked like balloon face.
Yeah.
And now it appears that, again, you're moving away to a different place, even with fillers. So it's like an evolution within cosmetics that there are changes. You've probably seen them in the span of your career, all these different types of changes.
Yeah. And there have been multiple publications about people backing off, less volume, more strategic placement of fillers.
The idea is to not look like you've actually had work done, right? That's the key. People want to, did you lose a little weight? What? You just, you look a little different. You look great.
Yeah. Well, along those lines, and it's a hard thing for me to explain to myself, intellectualize, and people always ask me, well, and I don't want to use any names and besmirch any of our actors, actresses, people in the media that are so obvious, but, why do people who have success and wealth and have been beautiful people their entire lives, why are they getting overdone cosmetic surgery? Why are they doing this to themselves? Everybody worries about Meg Ryan, so I'm not letting any cat out of the hat.
Pictures speak for themselves.
Yeah. And so, and I have seen the evolution in surgeons, especially in major media markets, where when we first started practicing, and I mean my peers, their results were very good, excellent, look natural. And over time, their results have evolved to look surgical and distorted and not particularly good, but extreme.
Mm-hmm.
And there are populations in this country where the consumers want an extreme outcome. They want people to know they had something done because it implies affluence, wealth, success. If they can go and get cosmetic surgery and look different than they used to look. I think that's a nightmare myself, but it has happened, and it does occur in, markets like the Northeast and the West Coast. And I think Florida has, the consumers have been good about keeping a lid on that and not wanting to look surgical, not wanting to look like they had something done, but wanting to look refreshed, rejuvenated, young for their stated age, fit, but not like they had cosmetic surgery.
Well, you cover an area that can go so deep with regard to psychiatric issues. It could go to, emotional stability, perception. And again, I go to social media as it relates to one's expectation of how they want to project and what society and culture, kind of puts on them and what they want to embrace. And you see it, obviously, Hollywood and the exaggeration of things you see, and you look at these people and you're like, what are they thinking, these people? Or what happened? What went on and why? But you also see in social media, these young kids who, this is my fourth nose job, and imagine my fourth nose job. The other part to it, it's like a domino effect. The ability to earn money today has become so much different than it was years ago, right? So you've got instances in which social media is a perfect example of that too. You've got young kids who can be influencers, can be on social media. You and I have no idea what they're doing. They're on their phone and they're making hundreds of thousands of dollars, maybe doing something with regard to reels or, selling products, whatever it may be, and have all this disposable money. And then see, they're a celebrity or somebody who's got their nose a certain way and go, oh, I want that for whatever reason. So I guess there's a fine line that you as a professional and a provider have to balance. and as it relates to your patient's care and also your reputation, frankly.
Absolutely. There's no question you have to bring people back to reality. And that's one of the most important things as a surgeon that we have to do. I'll have guys bring in pictures of Brad Pitt and say, I want my nose to look like that. And I'm going, well, your cheekbones and your jawline don't look at all like that. I can't make your nose look like that.
Let me go there for a second because I did want to ask you some questions about that. So percentage-wise of female to male patients, what do you think in your practice?
It's probably 80-20.
An 80 female?
Yeah.
Okay.
And I can say 15 years ago, it was 90-10.
So it's moved a little bit.
Yeah. Men have become more concerned, and youth has become a bigger kind of part of success. In other words, people feel like they have to look fresh, look good to be successful in our society nowadays. And it didn't used to be that way. So men are embracing that too. Some of it they get a little shoved by their wives, but most of it,
I see it too with Kristen in the practice. My wife bought me this gift certificate. I'm coming in to do X, Y, and Z. We talk about the fact that I think personally, and I believe in this, that if you are proud of how you look and how you feel, success evolves a lot quicker because you have that sense of confidence in yourself when you're presenting. You walk into a room, if you feel comfortable with yourself, your presentation speaks before you open your mouth. So I think that it has a lot to do with society has an opportunity, gives you an opportunity if you can do something so you don't look as old, or you can kind of rejuvenate. Anti-aging is in. You talked about so many different things that are available. And today, from a surgical perspective, it also evolved from a non-surgical perspective, all the things that can be done. Yeah. So I think that combination of people are living longer, taking care of themselves. There's a lot of reasons why I think we've moved to a place, especially men who, want to maintain a certain virality, so to speak, right? So it's something that, for me, I take to heart too. And plus, I have to. My wife is, make sure that, I take care of my skin and all these other things. I better. But I didn't realize that a guy would come in and probably say, I want that jawline, or I want this, or I want that. But that happens. Huh?
Yeah, sure does. And it almost happens, I would say, with the male population more than the female population. And the most recent person to bring in Brad Pitt, not to pick on him, but looked nothing like the guy. Had a nose completely different.
Sure.
But if you truly take a close-up picture of Brad Pitt's nose, there's a bunch of flaws with it. It's not an ideal male nose.
It's all perception.
It's all perception, and it's the way his nose is packaged on the rest of his face. There's no question he's a handsome as hell guy.
Yeah.
But his nose isn't as handsome as the rest of his face, but you lose it in the rest of his face. And so that's what I always tell patients. You have to look at a rhinoplasty as not a perfect nose. You're making it a better nose. You're getting rid of a hump. You're making it straighter. You're refining the tip. The nose needs to fit your face, but the ideal outcome with a rhinoplasty is having a nose that doesn't distract from the rest of your face. It doesn't distract from your eyes. It doesn't distract from your smile. It doesn't distract from the features you communicate with. Nobody except me, because I'm a little obsessed with noses, stares at people's noses. People look at your eyes when they're communicating with you. They want to see what you're doing with your mouth, or you're smiling, or you're frowning, And so a rhinoplasty really eliminates that distraction. There are perfect ideals with a rhinoplasty, but you try to get perfect and you're going to go crazy.
So the guys that come in, is it nose jobs and facelifts for the most part?
Typically, with men, it's nose jobs. And I would say there's a greater proportion of men who have fractured their nose, either in athletics or they got in a fight over a girlfriend or something. Somebody punched them in the nose. And eyelids.
Oh, yeah, because we age, with the eyes, sure.
And typically, I've had droopy brows ever since I was a teenager. So most men have heavy brows from adolescence on, just about. So eyelids are the most common thing in men. more, mature men, 40 and above.
Mm-hmm.
You go below 40, rhinoplasty is the most common thing.
What's your average age from a perspective of a patient that you would operate on?
It completely depends both on their physiology, but more than that, the procedure you're doing.
Okay.
So rhinoplasty, the average age is 25 to 30. With the facelift, it's moved south a little bit. As
And
far
when you
as
say
more like
south, younger.
45 to 55 now.
Okay.
Where when I first started practice, it was probably 55 to 65.
Okay. And more women, you said, generally than men. Do men come in, other than you had that outlier of Brad Pitt wannabe, but do men come in with an expectation of, how should I say this, a complete transformation with regard to their look, or are they a little more guarded and recognize that, there's not much that can be done?
Most are very realistic. Yeah. They'll have a heavy neck or, kind of a sagging jawline or something like that could be refreshed. And I would say most men that decide to do something also have aged beyond their years, either because of sun exposure, weight loss, something has made it where, they're 50, but they look 65. And so it's realistic to do the surgery and get them back to, 50-ish as far as age goes.
We find on our platform, and one of the things that I pride myself in talking about is older men, women too, but for whatever reason, the men generate more towards some of the things we talk about at times, that have been so focused on their careers and being the provider for their family and financial security for their family, that they don't take care of themselves, whether it be physically, whether it be emotionally. So later on in life, when they get to that point where they wake up, they look in the mirror, they don't even recognize themselves anymore. They go, oh my gosh. And then they go to see their doctor, and the doctor says, we got to get you on a statin or something like that. You need to lose X amount of weight. When was the last time you were in the gym? Well, when I was playing high school football, I was X, Y, and Z. All right, well, it's 30 years plus now. You need to take care of yourself. So I would assume you probably have individuals that come to your practice that had this like aha moment as well. And they're like, what can you do? I want to get myself back. I want my wife to, go, wow, remember who I was, and I don't even know who I am anymore. I'm sure you deal with that as well.
Yeah, you do get distracted by life, and it's kind of easy to do. As a personal aside, not to share too many of these stories, but I experienced a similar thing because you go along, and I have always believed most things in moderation, with the exception of exercise. I've always tried to exercise. I don't necessarily eat well, but I've always exercised. And halfway through COVID, so a couple of years ago, I started noticing I didn't have the fitness I had a week ago. And I'm going, okay, well, I had COVID. It must be long COVID. There must be some little cardiomyopathy from the COVID, or a little pulmonary parenchymal inflammation from the COVID. I kept making up excuses for why, when I would try to run, I'd get a little short of breath. I could cycle because I could pace myself better.
Yeah, you do ride. For people to know, you do ride.
Yeah, and so, finally one day I woke up in the morning and it was too severe to ignore. Call EMS. They were great. They got me to Tampa General in 10 minutes. I was probably in the ER for 10 minutes. I was in the angio suite in no time at all. And I would say within 20 minutes, I had 2 stents. I had 100% occlusion of one vessel. And 80% occlusion of the widowmaker, which is the left anterior descending. It's the one that goes to your left ventricle, which is the big part of your heart muscle that circulates. And hell, I felt better as soon as they put the stent in. Spent the night in the hospital in the ICU. Went home the next day and went out to dinner with my family the next night to celebrate. To celebrate that I hadn't died, but I ignored it, and I've paid attention to my fitness forever. You know, I'm not an extreme athlete. I don't do marathons, but I do Olympic distance triathlons.
Yeah,
and so you have to pay attention, and you do neglect some of these things, but. Jumping back on you said look in the mirror, usually what gets people is the photograph. Because you see yourself in a mirror multiple times every day and you can ignore that appearance. But when somebody takes a picture of you at a social event or with one of your children or your grandchildren, you're looking and go, who the hell is that guy?
Yeah.
And so it's usually the photograph that pushes people over.
Yeah, for sure. No, yeah. I could see that. And I look back too at the pictures. I mean, I talk about my transformation and I feel blessed. I went through this transformation. My wife helped me. I feel so much better now. God bless what you went through. I mean, to be able to get to where you are. Yeah. And I'm sure now too, and not that you didn't appreciate life before, but you're probably even more in tune now.
Oh yeah, it gives you a whole different perspective. You know, my wife and I have adopted the motto of yes. You know, people ask us to do something fun. Yeah, we're going, we'll travel, we'll do this because it's finite. You know, you can think you're going to live forever, but age catches up. And actually, a good book I'll pitch is, and I can't remember the author's name, but it's called Outlive. And it's by an author who was a neurosurgery resident, and near the end of his residency, realized that all he was doing was treating disease. He wasn't really helping people that much, and he wasn't preventing disease, and he didn't want to really just treat disease. So he changed his focus. It's a very, very scientifically based book, which for some people gets a little boring, on the things you need to do to live well and be healthy as you age. So it's not really about living longer. He calls it's not lifespan, it's health span. And so what you want to be is healthier until you reach the end of life, not crippled and still living another 10 years. You need to go up to the end and finish healthy where you can be active and do things. So it's a very good book. It encompasses everything from psychological health to sleep, to diet, to exercise, everything that goes into living a productive, healthy, active life. And maybe a little bit longer, but maybe not longer.
I'm so passionate about this subject. I wish I knew so much earlier on in my life. Then that happens to us with age, right? We look back in retrospect. The availability of information in today's day and age that we didn't have back in the day growing up, the seed oil issues. There's so many things that we can get into from a discussion standpoint, but I implore people who are watching and listening to really embrace life and the journey and recognize that life is short and not to be fatalistic about the decisions that you make, but to recognize that you really need to embrace the journey of what you're going through and live it. And just like you have with your wife, where we say yes if there's something there, you know, unfortunately it takes a certain event for a lot of people to recognize that. We have entrepreneurs who are grinding that are watching and listening to us, where they're so entrenched in whatever project they are to build up their career. It could be a doctor who's going through something, somebody in residency going through something. And so, you know, all the noise of life is an irritant to them. And it could be a loved one who needs their time. And, you know, next day they're gone. So it's finding that balance, I think, in life holistically. And those are the things that we talk about a lot, that I implore people to do. And if you can figure it out at a younger age, at a younger time in your life, I think that you'll be able to have a much more enjoyable journey of life as you move forward. I covet these years as I move forward with things. One of the bigger things for my wife and I was the elimination, for the most part, of alcohol. it was transformative. And we were social drinkers, wine, I loved my wine. I loved my wine. And, during COVID, we had a tendency, maybe like some other people who, maybe we overdid it here or there. We've got this redundancy of the day-to-day activities, but it's such an inflammatory alcohol, and you don't even realize that. And once I slowly moved away from that, lack of a better term, habit, in social settings or whatever it was, I felt better. And you don't realize how good you can actually feel until you eliminate some things. And then it just ends up feeding on itself. And I talk a little bit about that as well. Exercise too. I don't say I have to go to the gym. I go to the gym just like I go to the bathroom, frankly. It's just part of my life. It's not a chore or a checkbox that I think about doing. Food-wise, eating and the choices that I make, I consciously make these decisions. I don't eat fast food. I don't eat fried food. I just won't. It's just not me, and nor do I crave it. Yeah. It's just part of my lifestyle of where I am. And as you progress, and I tell people, you take that one step, you do it once, then you do it again and again, and eventually you don't think about it. Yeah. And it doesn't become a part of your daily hankering of things. And you're a prime example of it, what you went through.
Yeah, it is. I'm not quite as disciplined as you. I still have my glass of red wine, but once a week, not like during COVID when it was wine and cheese and crackers every night for dinner.
A lot of people went through that.
Just, okay, what are we going to do? Let's have some wine and cheese.
Exactly.
But it's, and there's been in the Wall Street Journal, in most newspapers the last 3 or 4 weeks, because, the Surgeon General wants to label wine as bad, or alcohol as bad for your health. And that's one thing they point out in this book is there's no good alcohol. Phenols are not. Mm-hmm. Phenols, anti-aging aspects of phenol, there's no good alcohol. And that's true. Now, if you're going to stress over things, I always kind of, my own justification is I look at the stress as more of a detriment in my aging than having a glass of wine once or twice a week. But like you said, it's a matter of habit. And if you just stop, you get used to it. You don't even crave it. You don't even want to do it. It just is easy.
Again, it's another cultural thing. People get together. There's a lot of different things. There's the whole event itself when we were into wine and everything about it. It's just like some people who do with cigars too. It's a whole, it's a process that you go through, an unwinding, a social interaction that can take place with it. And I'm not besmirching. People do, what they do. I just find for me personally and where I am in my life, I'm in such a better place. Anyway, there was never a negative towards it other than the aches and pains associated with it at times where as we get older, we don't metabolize the alcohol, I think, that we did when we were younger. So I think that affects, and that little bit of a fog that you have to fight through when that's eliminated is gone. And so for me, the clarity that came with it, and then when I think back in retrospect of how I used to feel with it, and I don't think I tolerate it like I used to. I think also the less you have of it too, I don't think the body really, I think it's like a foreign object coming at you when you haven't had it for a while as well. But that's just something that I talk about on the platform for people. And I know that, obviously there's an addiction element for some people associated with it. And that's a whole other area, we could go down. But for purposes of longevity, clarity, there's just so many benefits to it, and everything's in balance, right? With life, it's a balance of things. You don't have to be completely structured not to have something, because then the mechanism in your brain goes to a different place, like you said. Yeah. Whereas, what do you mean I can't have? What do you mean? And then the stress goes to another location. So you're just like moving around deck chairs on. It's just crazy. So. Talk a little bit about, and I've had John for a while, and we've talked about so many good topics. Talk a little bit about being a business owner in general as a facial plastic surgeon. Did you have any doubt when you got into the field that you could be a competent business owner?
Yes, of course. And I'm still not sure I'm the world's best businessman. What I have done is embraced what I'm good at. embraced what my passion is, and it's made it easy to do. You know, the business aspect, I could probably be more successful as a business person if I incorporated physician extenders, nurse practitioners, physician assistants, those kind of people in my practice. My approach to that whole aspect is I would rather have people like your wife, Kristen, that respect the work I do surgically and refer patients to me, where I can be a surgeon. I don't necessarily want to run a stable of people that I have to make sure they get along together. That's I get along great with people. I have fun with people. I am not I'm not the world's greatest businessman. I think the reason I've been a success is because I do what I love to do.
Well, I think that's important. You've recognized who you are and you've embraced who you are. And you know, I don't necessarily think success is measured monetarily. Yeah. I think success, you talked about passion. We talk about passion a lot. So you've embraced who you are. You've accepted who you are. We talk about at times with people, you know, how do they deal with money? Dealing with money is a very emotional element with people, right? So some people are good with debt. Some people aren't. So for purposes of building out a practice, so to speak, some people may feel comfortable taking out $1 million loan and build out a practice. Some people will say, there's no way I'm taking out $1 million loan. I won't be able to sleep at night. Or it may, you know, Kristen was on and we talked about this topic, whereas no, I'm not going to even consider jeopardizing my judgment associated with a loan in regard to my patients. I know that I'm comfortable not having debt. I'll slowly ramp up as my business, you know, grows and stay within my lane. I have no desire to take on all this debt. You decided, you know, was the decision that you made that my passion is surgery, I don't need to be big. Was that something that took place very early in your career, or did it come after you worked for somebody?
It definitely took place very early in my career. I had the pleasure of working with my dad for 10 years. And then, you know,
let me interrupt you.
Working with parents can sometimes be difficult.
But let me interrupt you. Did he have the same approach?
Yeah. He was all about being a surgeon and like I mentioned earlier, loving his patients. And you know, that's where I got it. I also have to give a bunch of that credit to my mom. She was a nurse out of basically Steer Creek, West Virginia, which is a small little community in West Virginia, backwoods. Went to Glenville State College for her AA, and then went to Duke for nursing school, and that's where she met my dad.
Did she work with your dad?
A little bit in the operating room.
Oh, okay.
When they were when my dad was finished his residency in Iowa. And of course, he always said she was the best OR nurse he ever had. And that was smart of him to say.
Yeah.
But she was. And my mom probably, my dad was a great, compassionate guy. But my compassion comes more from my mom. I mean, she was just fabulous. And both parents were great, very different. I'd much rather have my dad mad at me than my mother, because your mom, it hurts. You know, your dad, he gets it off his chest and reams you out, and then you move forward and everything's okay and you're pals again and it's all good. Moms hold a grudge for a little while.
Yeah.
So I never wanted to be on the wrong side of my mom. But how did we get here?
We were talking about the influence of you deciding early on to not necessarily stay in your lane, but just your practice. You wanted to be a surgeon. You necessarily want a big business.
Yeah. And I'm still that way. You know, you look at it and you see all these people with stables of extenders and things or every late device. And you mentioned Kristen and her approach to things. And when you buy a $200,000 laser, you got to pay for it.
Sure.
And so you're treating people with it that are not appropriate to treat with it, and making promises to those people that you can't keep, and taking their money, and they're not going to get anything out of it. I can't count them all on both hands. There's not enough space.
Yeah.
People who have come to see me, about a facelift and tell me they've spent $4,000 or $5,000 over the last 3 months on some device and it hadn't done any good. And it's because somebody bought that device and they had to use it to pay for it.
Yeah.
And so they kind of took the shotgun approach, used it on everybody, and it would make a difference in some people and not make a difference in other people. So I've tried to avoid that. I have one device in my office, well, two, that I know work. A CO2 laser, which is carbon dioxide laser, which is for resurfacing and mostly ablative resurfacing. So for really deep wrinkles and sun damaged skin. And then something called an IPL, which is intense pulse light, that helps with pigment and blood vessels and that kind of stuff. So those are the two devices I have. They've both been paid for 10 years. The technology hasn't really evolved that much. Mm-hmm. And so they're very useful to have, but they're something I never made an effort to pay for. I paid for them with the revenue I got from surgery and used them where they were appropriate.
Well, you have a little surgical center that you built out as well, and you've essentially come to terms with what you want it to be as far as a professional. You didn't have these aspirations of managing, 20, 30, 40, 50, 60 people in an office. It seems that you recognized that early on. So right after your dad, you worked for your dad, you said about 10 years. Right after that, you went out on your own? Is that what happened? Well, or you kind of took over his practice? How did it work?
No, I went out on my own. And that's when I built the office you're familiar with.
Okay.
And then I just expanded it 2 years ago.
Okay.
And that's one of those, am I comfortable with that? Yeah, I'm kind of comfortable with it. And my wife is always kicking me. What are you doing? Spending whatever, $1.5 million on doing this thing. We're going to be tied to it forever. But it, it makes the practice nicer. The space is more comfortable for people. And now that it's most of what I built is rental space. So I've got a tenant, so it's generating its own income. So I had the land in South Tampa and I wanted to take use of the land I had. So I put something on it.
Yeah, it's beautiful the way you set it up. The aspect of running the business, running the practice itself, how did you learn and become competent at? Was it Dad?
It was Dad and his office manager, Edith Roberts, and then my office manager, who's been with me 24 years. So she started shortly after my dad left, or I left my dad. Leonore Wells, who's fabulous.
Yeah,
and how well she communicates with everybody.
Yeah.
And I think the biggest thing I've done is my staff believes in the care I provide. And that's what's made me successful, made me have a happy work environment, because the people who work for me respect me and what I do. And I think they all like to be there. They come to work every day, hopefully with a smile on their face. And we try to have a nice work environment. I don't, micromanage people. Mm-hmm. I believe in pretty much everybody, at least that I've encountered in in my workforce, is committed to doing a good job. And that's the people you need to surround yourself with, people who take pride in their work. And then you don't have to worry about whether or not they're crossing the T's or dotting the I's and, picking up the dirty Kleenex on the floor, doing a good job cleaning the surgical instruments. They take pride in what they're doing. And so they do those things. So you don't have to lord over them and always be there looking at them, supervising what they're doing, because they take pride in what they're doing. And that's the kind of people you need to hire.
Well, you obviously understand the business aspect of things, and you want to set the tone for your own office, and you do that as the leader. You're running the show, and they see you. They see the passion that you have for what you do. And you've put, Leo's in there, and she knows, clearly she's been with you that long, is a credit to you as far as the environment is concerned. Was there ever a focus on money? And the reason I bring that up is because we see in today's society these plastic surgeons that are charging ridiculous amounts of money to do things, and espousing. It's more, I think, not so much on the facial plastic surgeon side that you just see a lot more plastic surgeons in general, right? That are doing all over the body, and charging ridiculous amounts of money. And it is predominantly an elective space, right? The plastic surgery is not necessarily insurance driven. Maybe there may be some instances, right, that there could be insurance, but percentage wise, it's probably low, right?
Yeah, it's the reconstructive side.
Yeah.
So trauma, cancer, that kind of thing. Yes.
Yeah.
But the bulk of what is done in a plastic surgery practice or a facial plastic surgery is elective, fee for service. It's hard to, I don't know, get a handle on that a little bit in that because it's market driven. If you can get away with charging an exorbitant amount and find somebody that's willing to do that, you know, how do you criticize it? I don't have that approach, but it's, you know, like the guy in New York who's charging $200,000 for a facelift. Well, you know, you can go across the river to New Jersey and get it for $15,000.
Yeah.
And I can tell you the guy is not better than anybody else up there.
No.
He just, pardon my French, has the cojones to do it.
Yeah.
And
people are going to pay. They're going to pay, I guess.
Yeah.
So credit to him, I guess, that he's been able to market demand and he just satisfied. But for you personally, with regard to your practice, it's never been, money it doesn't appear how you've set up your practice and how you approach. It's never been the driving force. In other words, you're not looking for that. You seem to be very confident in who you are and how you like to approach your career.
Yeah, that's true. And I've always been more focused on the patient, and I don't want what I'm doing to try to make them healthier. And there is a health associated with how you feel about your appearance. I haven't wanted to make it more painful by making it unattainable financially. And so they sacrifice themselves, whether it's taking a loan out or a second mortgage on their home or something like that to get cosmetic surgery, which a lot of people will do.
Yeah, yeah.
And it was especially crazy back in the early 2000s when we had the Swan and Miami Slice, and there were all the Extreme Makeover. There were all these TV shows about cosmetic surgery, and people were mortgaging their future to have a facelift, and that makes no sense. And so, I want people to have access. I got to make a living, so I don't do any of it for free.
Yeah,
but I didn't want to exclude folks solely based on how much it cost, that it was too expensive for them to do it.
So that was your business approach, which was great. How were you able to maintain your practice for the most part autonomously? A lot of people enter into partnerships or associations in order to, build up a larger base, I guess, a patient base. Was it predicated on this idea that, I'm happy being small and competent and making a nice living without the extraneous issues associated with either a partner or an association or a group or somebody, telling me how to do things? I mean, how did you reconcile all that as you evolved in your career?
Being comfortable with where the practice was and what I was doing. And again, it's back to knowing my limitations and not feeling like I had to compromise what I was doing to make somebody else happy. Now, I've had two partners. 5 or 6 years ago, I hired a plastic surgeon that was with me for a couple of years and then left in his practice in Tampa. And then a few years back, hired a facial plastic surgeon. And I would say the consistent feature there was they didn't have the patience to get busy. They expected to, have a surgical caseload that was full from day one. And that's not the way it works in cosmetic surgery. You have to be in a community. You have to build a reputation. You have to take emergency room call. You have to prove to other physicians in town that you're somebody that they would bring their wife to for an elective operation, which they don't need, they just want it. And so I think the biggest thing, they were both just a little impatient. And
well, you bring up a good point. Let's talk about that briefly. And I know I've had you on for a long time, but my brain tends to go in all different places. And this is where I'm going now. Today's society is an entitlement society. Today's society is give it to me now. It's a Google-ridden society. So with that, what are we going to get? We're going to get doctors who come out of school after a certain amount of time and say, because I get it on the legal field too all the time, that I have an expectation of X, Y, and Z, and included in that is a couple of zeros after it as well. And I should get it because I just finished school and I deserve it. I'm sure you dealt with that as well. Frankly, I like being autonomous with my practice. I don't like having partners. I've been that route. I've done it. I've evolved. I've come to terms with who I am. So you probably have dealt with that. And it sounds like you've experienced, elements of that in partnerships.
Yes. And it is the case, good or bad. I can't be the judge of that. But they are about experiences and embracing life while they're young. And at least my generation, when you were young, you worked and you embraced life when you got close to retirement, which may not be the right way to do it.
Yeah.
But they are different, and they do expect the zeros early.
Mm-hmm.
And, we were also a generation, there was no gap between undergrad and grad school. And then there was no gap between grad school and residency. And then there was no gap between residency and starting a practice. And most of us had children when we were in our late 20s, early 30s. So you had the responsibility, you had to make an income, you had to do these things. And whether that's healthy or not, yeah, I feel healthy. I think I enjoyed my life. I made it a priority to get home in time for dinner at the end of every day, or in time for volleyball or basketball practice at the end of every day. And then after dinner and after the kids went to bed, I went back to the office and worked. And it's kind of the way we did it.
Mm-hmm.
And I'm not sure most of the people coming out nowadays have that same priority. And maybe their priority is health. Maybe they'll live longer and be healthier than we've been, but I don't regret any of it. It's been a good life, to say the least.
I think the old school, there are good things about the old school. I think, you nailed it with regard to prioritizing things. You're going to take care of your family. You're going to be there as the provider, but you're also going to be the dad at the times, but you're also running a business, and you've got to take care of that. And you were blessed in your spouse that understands those aspects of things and supports you to do those types of things, which is all part of the pieces of the puzzle, right? That, of life.
Yeah.
And it's not everybody, because I have some young people that I work with, surrounding us as we talk right now, who have the desire to work and apply their skill, so to speak, earnestly, and take the time to develop earnestly. But there's always going to be people who want shortcuts and have expectations. And I find that the best thing that we can do as older individuals is allow them to go and allow them to move on, because they're going to have to experience life rather than keep them as a captive or coddle them. We're going to have to let them go and find their way, because they're going to have to evolve on their own to a place that they recognize where they are.
Yeah. And as we all know, experience is the best learning tool. And so you can tell them all you want, oh, you need to do this, you should do it this way, you should do this way. And that's deaf ears. They need to do it, experience it. And I wish everybody the best of luck.
Exactly.
That didn't work out with me.
Sure.
I want them to be successful. They will learn a bunch. And realize maybe what they had wasn't as bad as they thought it was, but it is what it is. And, the other thing is prioritizing, your profession, family, that kind of thing. I would probably have to say that's been the biggest difference between my dad and me is that family was first and profession was right there, a close second, but never the main priority. And that started making a good choice when I was 24 years old and met the woman I wanted to marry.
Yeah, you got lucky early.
I sure did.
Yeah.
And we've been 43 years this August. And, she's a lawyer.
Yeah.
Does appellant work, but has been a great partner, a great mom, a lot of fun, a good traveling companion. So, it all fits. And it's...
adds to your success.
No question.
And that's what we talk about as well. One of the most crucial decisions you have to make in life is your partner.
Yeah.
In personal life.
No question. And it's, you have to, from my perspective, you want to choose an autonomous person you can have a symbiotic relationship with. I don't want somebody that's dependent on me for their self-worth. They need to have their own, and then you work together and everybody gets better.
Absolutely. That's a great way to describe that. Well, I had you on a long time. I really appreciate the time that you took to talk to us. It was great. I think that people are going to really enjoy listening to you and how you evolved. One of the things before we end, I want to let people know, because I don't know if they'd recognize this, at least the Tampa people would understand. You're really involved in this concept of Gasparilla as part of Tampa, right? So explain a little bit just to the people before we end what Gasparilla is for Tampa and how you're involved in it.
Gasparilla is kind of whether Jose Gaspar was a real pirate that ever made it up to Tampa or whether he's semi-fictitious is debatable. There are a bunch of islands on the west coast of Florida, Gasparilla Island, Usepa, Captiva, which is apparently where he kept his captives and stuff down on Charlotte Harbor. And it's a fun festival that was started about 100 years ago now.
Oh my God, I didn't realize it's that old.
It's been going on for a long time. And they used to have a real sailing ship that they put the pirates on. Now it's kind of a dressed up barge, which is fun. Does good stuff, some charitable work, visits children's hospitals and other things. It's kind of Tampa's version of Mardi Gras.
Yeah.
And it's been fun to be part of. It's so hard for younger people to get into it. Now I'm looking at it going, okay, how long do I do this? Or do I turn it over? It's a little bit of a younger's man game.
Because you actually dress up as a pirate, right?
With makeup and everything.
Yeah. And you probably have a lot of, old Tampa people, like, not old, but I mean, people have been running around a long time that do it, right?
Yeah. This is public knowledge also, so I'm not letting it cat out of the hat. But, Vinny LeCavier, all his years playing hockey for the Lightning, All-Pro, All-Star, whatever, Hall of Fame, never lost a tooth. Gasparilla, he was standing up on a bus going from the boat to the parade. The bus hit the brakes. He fell. Hit his tooth,
gosh.
Knocked the tooth out at Gasparilla.
That is funny. Little tidbit.
Yeah.
Wow. Yeah. It took him all those years. Yeah, he's a Hall of Famer, right?
Yeah, Hall of Famer. And he gets injured at Gasparilla.
That's funny. Gosh. All right. With that, thanks again for being on Pro to Pro. Hope you guys enjoyed this episode of Pro to Pro, and we'll see you soon.
Pro to Pro.
That's all for today's episode of Pro to Pro. If this podcast resonates with you and you'd like to be part of our membership network, be sure to check out the Pro to Pro Collective. Please like, subscribe, and follow us on social media for more content like this. Thanks for listening and watching, and remember to keep it Pro to Pro.